I would like to ask Dr. Samuel Jacob from the University of Illinois to come and give us the talk on common bile duct exploration in decline. A majority of these procedures are done in non-teaching hospitals in the U.S., and the co-authors are Dr. Marek Rudnicki. Please, Dr. Jacob.
Good afternoon, everybody. You must have had, a long day. This is Samuel Jacob from the Metropolitan Group Hospitals and University of Illinois Residency Program. So as first, I would like to thank SAGE Committee for giving us a chance to present our study, and thanks to Dr. Katkuta and Jade for their introduction. So as mentioned, common bile duct exploration is in decline. That's what our study showed, actually. So nothing to disclose. We are following the rule of presenting the abstract here. So the background of common bile duct exploration, actually, it used to be one of the common procedures, almost every general surgeon had one on his list once in a while or even every week. So nowadays it's different, because if you ask chief residents here, what is the T-tube, maybe you might not get an answer from him because they are not really used to this type of procedures. Mainly this is related to rise of minimally invasive techniques, and everybody expect surgeons nowadays, they have to adapt to that and find change their approach to this procedures. I know some people actually, even in our program now, they switch to, they are doing the ERCP themselves instead, as a compensation. And our previous study actually is related to the topic. We presented to the American College of Surgeons. We showed there is a decline in intraoperative cholangiograms from 40% nearly to 32% recently. And having said that, one may expect hepatic common bile duct exploration will be reduced throughout time. Our objective in this study is actually first to determine a nationwide trend of cholecystectomy and common bile duct exploration over a period of more than 10 years. And secondly, to evaluate utilization of those procedures in teaching and non-teaching hospitals. We had not main objective we included in our manuscript, type of hospitals and bed size, and to make the talk shorter, we will skip that. Methodology, we analyzed the nationwide inpatient samples for healthcare cost and utilization between 1997 and 2007. And we used the International Classification of Diseases version 9, because version 10 maybe it's not available yet. We used the codes 5122 for laparoscopic and 5123 cholecystectomy, and the same for common bile exploration with and without stone removal. The data were subcategorized based on the multiple hospital characteristics, but mainly we talked about teaching and non-teaching hospitals and being a resident. And the trend actually were studied using trend line with R-square value as a coefficient to determine the statistical values. Our finding is, looking at this graph, is the cholecystectomy is laparoscopic versus open. If you see the number of cholecystectomy in general, it's not changed really, that it's ranging between 450,000 a year. However, if you look at this graph, the middle line is the laparoscopic, which is increasing in the trend, and the open cholecystectomy is really decreasing. If you take 2000, the two lines that are getting apart. So it's open is less common, getting less common. Expected in 10 years from now, maybe it will really vanish. So we had the data from 97. We went back a little to 1993, where the ACGMA started to report in resident logbook the data. Then actually the laparoscopic cholecystectomy is decreased since 1993 till now. Teaching and non-teaching on the cholecystectomies, as mentioned, non-teaching is more, most of the procedures are done on non-teaching hospitals nowadays. Interestingly, open cholecystectomy, still though it used to be done most likely in non-teaching, but if you see the line, the bottom line is in 2007, it's more done on teaching hospital rather than non-teaching, like percentage 52 to 48%. A total laparoscopic cholecystectomy in teaching, non-teaching, and study, it's non-teaching more than teaching and didn't change over time. The common bile duct exploration, there's really a decline in general in total number of common bile duct explorations from 25,000 nearly to 9,000 recently, and most of them done on non-teaching hospitals. So you have a decline in both teaching, non-teaching, and the total number of common bile. We subdivided the exploration to the two major sections, calculus removal or 4 stone, or non-calculus if you wish, without a stone. And both trended down over years, and there's in 2007. Summary of results: number of cholecystectomies actually did not change over the observed period. However, I mentioned it maybe in 1993 it was more than what used to be between 97 and 2000. Open cholecystectomy declined, and number of laparoscopic cholecystectomy increased, and interestingly, the open now cholecystectomy done more in teaching hospitals. Number of common bile duct exploration showed a decline trend from nearly 25,000 in 97 to 10,000 2007. That noticed in both actually teaching and non-teaching. So at the end of the summary of results, there's common bile duct exploration per 17 cholecystectomies in 1997. That really increased to every 45 cholecystectomies you have one common bile duct exploration. Conclusion: this is we studied during 1997 to 2007. There's a steady decline in all common bile duct explorations, and in both actually institutions, whether teaching or non-teaching. And because of that decline, one may expect the future of general surgeons might have insufficient experience in this procedure. Thank you.